I'm Gloria Strode, and welcome to Straightforward. Today we have a special treat. All of our great friends from the Veterans Administration Healthcare System. Welcome, Patricia and Kevin.
Thank you.
Well, you all are out in the field taking care of our veterans and making sure that they have everything that they need on a daily basis. So Patricia, you are the famous social worker. You know I'm partial to social workers. I was one myself, so I know that you're working very hard. It's not a career that you will get wealthy doing, but you have the passion. So share with our audience what it is that you all are doing in the social services department.
Well, I'm very excited to be here. Thank you so much for inviting us here today.
Oh.
Kevin and I both are within the Social Work Service Department of the Central Alabama Veterans Healthcare System. I'm the Acting Chief of Social Work Service. We have a service of over 100 social workers and
Really?
auxiliary staff.
Really?
And social work has been a part of the VA for over 90 years.
Almost 100 years. We always need the folks that take care of other folks. Then sometimes we forget to take care of ourselves, but that's another conversation for another day. Okay, so for more than 90 years. Yeah.
Social work is a part of every program at the VA. And here in Columbus and Fort Benning, we have our clinic, CAVHCS, and the PAC team, the Patient Allied Care teams, all have social workers embedded within those teams. Social workers act as the conduit for not only access to care, but also evaluating what are the other psychosocial needs for the veteran. What's their transportation? What's their home life like? Are they getting support in the home? Do they need caregiver support? And then as our veterans go through, you know, we have veterans that are coming in at 19.
Yes.
All the way through to our World War II veterans who some are in their late 90s,
Yes.
early 90s, that we're helping take care of them and making sure that all the services we have available, that we communicate it to them and make sure they have access to them.
Wow, that's a broad spectrum because I know we've had a war and a lot of the young people went in straight from high school. And so they did a couple years and now they're out. So you're having to work on a care plan, social service plan for them, as well as World War II veterans. I mean, that's a lot. That's a lot in between. And the needs are different. So if you're 19, you might need a job, which is what you focus on. But if you're 92, you probably need a caregiver. Okay, so Kevin, where do you fit in?
Where I fit in is the employment piece. So it's like you just mentioned that so many of them come out at an early age at 19 and whatnot, and they're looking for employment. You find a lot of veterans get lost when they come out of the military because they don't know the direction to go.
Right.
And so I provide career guidance for them. I work with them to help them decide which path to go down, which is the best journey for them after doing maybe 10, 15, 20 years of service. It gets difficult for them to try to figure out which way they want to go.
And so you try to help them take the skills that they have in active duty and then translate that into the civilian world in terms of finding a job, the new career, the next move.
That's exactly right. And I really try to focus in on careers for them because we can get jobs, but it's more important since they just did a career with the military for them to have a career for their families. And we try to focus in on that, and that's the reason why what we provide is resume writing, the job readiness skills such as interviewing skills, because many of them have not had that opportunity to interview in a long time.
And you are so right, because in the military it's very different than the civilian world. And they might not have ever done anything but talk to the Army recruiter. And so that is, that's wonderful, because they need to know what we do in the civilian world.
Exactly.
The cans, the do's, and the don'ts.
And the translation from civilian to, military to civilian life.
Right.
Because the word terminologies and the acronyms that they use in the military are not used in the civilian world.
That's true.
So we have to teach them how to put that on their resume and be able to represent themselves the best way.
I think that's very important too, because of course my husband is as a defense contractor, and he was a military officer, but after his first corporate experience, he realized in the Army you tell people to do it and they do it because it's an order.
That's right.
in corporate America, it doesn't always work that way.
Does not work that way.
So when you get those military lifers, you know, or those that have been socialized in the military lifestyle, that you have to help them make that transition.
That's right. And, you know, and speaking of that, we have a partnership with Department of Defense, and we created a program called VTAP, Veterans Transitional Assistance Program, which is to, you know, when they come out of the military, they have TAP, Transitional Assistance Program, and they learn how to transition to civilian life. Well, sometimes our veterans get lost, and so we got to take them back to TAP.
Really?
And that is a program that we put on with Fort Benning. So we take them through back to the interviewing skills and Dress for Success. And they have such a wonderful program over there. They even allow them to have clothing with Men's Warehouse. They'll give them these suits and things like that to help that veteran really fit back into the mainstream of work.
Right, because they're accustomed. Those are things we take for granted, to wearing a uniform. And so now you have to, and on their casual days, they probably wore jeans and maybe a t-shirt or sweats. But if you're going into the workplace, Total Systems or Aflac, then you're going to have to do something different.
That's
jeans and a t-shirt or sweats won't work.
Does not work.
And you're no longer in that uniform.
Correct.
Yeah, that is really awesome. So you are based in Tuskegee.
My office is in Tuskegee. Of course, we've got Tuskegee, Montgomery campus, our MVAC. We have a location.
What is MVAC?
That's the Montgomery VA clinic.
Okay.
And that's one of our CAVHCS, or community-based outpatient clinics.
Okay.
And so we also have one in Monroeville, in Fort Rucker, Fort Benning, and of course in Columbus.
Okay. And so your team of social workers, and how many? It's over?
It's well over 100 in terms of the social workers as well as our support staff. Part of what, you know, we have specialty programs to help all the different veterans that are transitioning. For our younger veterans coming out of OEF, OIF, OND, Operation Enduring Freedom, Operation Iraqi Freedom, Operation New Dawn. We have a program called Transitional Care Management. And so for our younger veterans, as we had mentioned earlier, coming in, what we're striving to have is a seamless transition from their military. And right now, Columbus is our highest population of growing veterans. Many of our soldiers leaving out of the military, out of Fort Benning, choose to stay in Columbus for the incredible community resources here. So that's one of our biggest growing areas. And for some of these veterans, they're coming out of the military possibly with different levels of support. So part of our goal to end homelessness, because we have a lot of younger as well as middle-aged and older veterans in homelessness, Kevin's role also greatly suits them because it helps to end concretely homelessness, where we have a whole team of social workers in our CAVHCS program.
What is CAVHCS?
That's our collaboration between Housing and Urban Development and our VA. And so what that is, we have vouchers. Here in Columbus, we have about 40 vouchers, 38 of which are used right now for those CAVHCS housing, so that veterans can end homelessness into a lower income housing, and that support is there for them.
That is awesome.
Tying that in with Kevin's program and getting people employed
that
really helps to end that homelessness and that cycle.
Absolutely. Well, what we're going to do is take our first break, go to our sponsors, and we'll be right back. Okay. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you. Stark Avenue, Columbus, Bradley Park, Columbus, Lafayette Parkway, LaGrange, East Burkhalter Avenue, Buena Vista, and Springs Street in Warm Springs. Thai Cuisine, the area's only authentic Thai restaurant, open for lunch and dinner, Monday through Saturday, located in the Village Green Shopping Center on the 280 bypass in Phoenix City. Apple Tax Services, located at 7413 Whitesville Road, Suite 400A, as in Apple. For professional, efficient, and courteous service, call today at 706-243-2595. Apple Tax Services, a company you can trust.
Walmart's reason for supporting Thurgood Marshall College Fund is simple. We like to win. And we have been given a lot of exposure to some incredible talent. And we also believe that it's a part of our responsibility to the community to give back. This is a great opportunity to do both. It's been a wonderful experience for us through the years. We've appreciated our partnership. We believe in return on investment, and we have definitely had a remarkable return.
Welcome back to Straightforward. I'm continuing this awesome conversation with Patricia and Kevin. They're on the ground doing so much, taking care of our young soldiers from the very young, about 19 years old, up to our World War II veterans. And we just have to commend you all for what you do, because this has to be a passion. It's not a wealth position. If you want a wealth position, you got to go to Wall Street. Right. Okay, you have some other services, and of course, we were talking about the partnership with HUD and the VA, and that's a national program. So if someone should see this and they have a family member that's living somewhere else in another state, then they can pass that information on. Is that correct?
Absolutely. You know, we do have our community-based outpatient clinics,
right,
but we also have our outreach teams. We have transitional patient advocates, or TPAs, that go out into the community to do speaking engagements as well as outreach to veterans. We also have our homeless team that goes out and literally drives out into the community and ask people, you know, are you a veteran? How can we help you?
Really?
Do you know this is available? So we're out there reaching, but we rely also on family and community to call us and let us know about a veteran they're concerned about.
Right.
We do have our triage hotline at the VA. Can I give that number?
Oh, absolutely.
It's 1-800-214-8387, and then extension 2549.
Okay.
That triage line is staffed. It's also a walk-in triage on Tuskegee campus.
Right.
It's 2400 Hospital Road, where a homeless veteran can come and get those services.
Right.
Also, in terms of our national hotline, which is, we rely on that as well, is 1-877-424-3838, and that's a homeless hotline, and we'll receive calls from other states, and they'll say, there's a veteran in Columbus, can you please help them?
Right.
And getting that information, our team then receives that and is able to go out and serve that veteran.
I think that's phenomenal. So we do have some places, and what I did find, some of the veterans are out because they have PTSD. They don't want to be inside. Right. You know, and they feel more comfortable, and particularly with some of the Vietnam veterans. And they are some older people, and they've been out on the street for a long time. But you got folks that's out there that's looking for those folks to say, look, we can do this to help make it better, you know, and they can take advantage of it, or, you know, it's a choice. But at least you all are out there looking for them, and I just think that's just really, that's fantastic. But you have some community resources, you're collaborating with people, and you're going to try to come and do some things in Columbus that you've been doing down in Montgomery.
That's correct. One of the things that, being on boards back in May, I developed a collaboration called Central Alabama Veterans Employment Council, and that consists of different organizations within the community where we come in and address the barriers of a veteran to employment. It could be driver's license, it could be automobile, it could be some financial concerns, and what we try to do is bring us all together to address those issues. And since then we developed a bike drive that we're going to host in May in collaboration with Goodwill in Montgomery. We're going to have the whole month where people can donate a bicycle to give to a homeless veteran so they can get back and forth to work.
Right, so if they don't have a driver's license, they can ride a bike.
Exactly.
And so you're going to be collaborating here in Columbus with Goodwill, and you're going to be doing a resource fair.
We're going to do
an
a resource
employment fair.
That's correct.
Right, and so we're going to be able to publicize all of that information out on social media, and folks will know where they can go and get some help.
That's correct.
Right. Now, you were saying something about some of the retailers were providing suits or clothing and things like that.
Yes, there's the partnership with Men's Warehouse through Warriors for Life, and the folks can get a suit. The men can get a suit so they can have for their interviewing.
Really?
Yes.
And that's free?
Free.
So they just have to prove that they're a veteran.
Correct.
Right, and then they can take advantage of that resource.
Correct.
Because again, we went from the uniform and we didn't really quite know that we can't wear the sweats,
That's
you know,
right.
because when you're in the Army, if you're off, you can wear sweats.
That's right.
And so you all have put a resource in to try to help them with
Yes,
that.
we have.
So we do have a lot of homeless women veterans,
Yes.
and I think sometimes they just kind of get lost. So you have a team that's focused on working with the women?
Well, we do have a women's health program,
Okay.
and that at every site, you know, in terms of medical care, you can be part of the women's health program. And then we do have specific activities, and we have homeless women stand downs, we have baby showers.
Really?
Yes.
We have all different programs that we're driving to not only reach out to the women, but to make sure they're coming in for their health care and that it's suited for their needs. Right now, about in terms of the OEF population, it's about 16% are female veterans. And so that percentage is always growing in CAVHCS for our female veterans, and the services are being provided to meet that.
Okay. And so when we say Central Alabama, just for our viewers, we're talking about we have a clinic here in Columbus and we have Fort Benning. It just happens to be a part of the Central Alabama region.
Correct.
Right. So it doesn't mean that we're just talking about services in Alabama. We do have resources here in Columbus. I think we have a clinic is down on 13th and then out on Fort Benning.
Correct.
And so a lot of these same services. But what has intrigued me is the baby shower. So when did that come about? I mean, is that just for, how does that work?
That's something that Dr. Hall, Dr. Peggy Hall is our women's health coordinator, and she just started developing more and more what are the special needs of this population.
Right.
And throwing a baby shower for someone and getting them those tangible gifts that they need,
Yeah.
and also having information fairs for them, allow them for increased information that they may not have gotten if they hadn't
Right.
come in and brought that in.
I just think that's really great because we do it in the corporate world. You know, we're always in the workplace. If somebody's having a baby, then, you know, but I just think that's really special. And I think we really need to do more things to make our veterans feel special.
Yes.
Because it's a big sacrifice. And so you are a former
Military,
military.
U.S. Army.
Army.
That's right.
Okay, and what was your specialty?
I was a radar mechanic there.
Really?
Yes, ma'am.
Okay, so were you able to use some of those skills as well?
Actually, and analyzing.
And analyzing, yeah.
So in every career, you can always find the transferable skills. So
Right.
analyzing was mine.
Oh, okay.
And be able to figure out how to help that individual. So that's how that comes
All right.
working my way.
Well, I want to commend you all. I just cannot say enough about the work that you're doing. I know it's thankless, but there are some of us out here that we really appreciate what you're doing. I just want you to stay in the fight, continue to work hard. Dr. Boyle, you all have an awesome team, and we'll be cheering you on, and we'll have to get you back, and so we can just keep all of the citizens informed with all the great things that you're doing.
Absolutely.
Thank you so much.
Thank
Can
you.
I give one more phone number?
Yes, please.
This is for our crisis line. It's 1-800-273-8255. Press 1 for veterans. And it's a crisis line. And so for any family or veteran where the veteran is concerned, we want to hear from you.
All right. Well, thank you so much.
Thank you.
All right. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. Freedom Printing for all of your designer printing needs. Gunboat Plaza, Suite 18. Zeal in Uptown Columbus, where you can enjoy an intimate dinner atmosphere, and every entree is chef-inspired with passion. Dinner is served Monday through Saturday, 5 p.m. to 10 p.m. Howard Johnson Hotel, 1011 Veterans Parkway, Columbus. For an international dinner experience you will never forget. Zeal in Uptown Columbus. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road. Trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life.
History is important because it shows where you're coming from and where you're going. Type 2 diabetes is something that runs in my family, which means I'm at risk. In fact, 1 in 3 American adults are at risk for developing type 2 diabetes. And knowing this, if I do nothing, that family history becomes my family's future. And my family is too important to me for that. Take the risk factor assessment today at AskScreenKnow.com.
And welcome back to Straightforward. I'm continuing my conversation with the awesome team from the Veterans Administration Healthcare Systems. Dr. Boyle, thank you so much for coming back.
Wonderful to see you again.
I know. We were so excited to have you last time and this great team. Your team is just phenomenal. The people you brought last time and the people you have today, it just really speaks to all of the hard work that you all are doing at the VA and trying to take care of our veterans. So you have a lot of things going on. What can you share? What are the pearls of wisdom this time we need to share with our audience?
I think it was really important after talking with you last time to look at those things that I thought perhaps would be special interest for down here in Columbus, which is why I brought the social work and the homeless program. The other thing I believe there's probably a lot of interest amongst your veterans is concerning care in the community and the care that we cannot do internally. How do we feed that out, or how do we do that into the community so that I'm able to be seen? And that's why I brought Miss Denise with me this time around to have that conversation.
And so Denise is the person that's boots on the ground and making sure. So you are the community care
case manager.
Case manager.
And I'm glad to be here as well.
Okay.
In our program, we're just to ensure timeliness and just access to care within the community. And if the veteran, we provide services. If we're unable to meet those services in-house, we establish care for the veterans in the community.
Okay.
And within their local city or closest availability to them.
Okay. And so you're the person that's looking at the medical, and
Yes,
then
ma'am.
if it's something that you all cannot do at the hospital,
Yes, ma'am.
then you and your team will make sure that the veterans get that care in their very own communities.
Yes, ma'am.
Okay, because in Columbus, a lot of our veterans, if they don't go to Tuskegee, then they're going over to Montgomery.
Right.
And so, but you can kind of figure out, well, you might not have to go to Montgomery.
Exactly.
I might can find that resource for you at your home.
Yes, ma'am. And we utilize non-VA care, and that's through the traditional fee basis, but we also have the choice program.
Okay.
And the choice program is just that. Our goal is to develop care, to develop a care plan and provide care in the community closer to the veteran.
Okay.
Because a lot of the veterans have access to transportation, like barriers.
Right.
So our goal is to provide the access to care
Okay.
for veterans.
And so with the choice program, that means that they can, it's not just specifically, it has to be at the VA with a VA doctor.
Okay, the choice program, if our service is not available in-house, then if they what we call opt-in, if they elect to utilize the choice program, which President Obama passed, then they can opt into choice. And what we do, if they're eligible for services, then we coordinate in the local community an appointment for the veteran.
Okay.
And then the veteran can access that care.
So you will set up the appointment. It's not the veteran, because a lot of times they just really don't know, or family members might not be familiar with how
Right.
to work that system.
Yes, ma'am. We can set it up, and also the veteran, once they opt in, they can also call HealthNet, which is the third-party provider. That's who manages the choice program.
Okay, and
For
so
our
there is,
area.
you get them on the path, and then once you've
ma'am.
gotten them on the path, they should be able to take the wheel and drive.
Yes, ma'am. We're coordinators, and they also, we have each case manager, we have our own specialties, so we're divided, and then our veterans get our numbers, and then they can call
Okay.
if they're, if they meet like a complication within the process. But we do coordinate the care, and then if they need follow-up care, we also coordinate that.
Okay, and so what are the specialties? Is it like orthopedics? Is it
Orthopedics, pulmonary, pretty much every specialty. Neurology, we do have in-house neurology now, which we're thankful for that.
Really?
Yes, ma'am. Pulmonary, oncology,
Wow.
just urology, dermatology, pretty much any specialist that that's
Okay, just
needed.
like in the
Yes,
open
ma'am.
market.
Yes.
Wow. So you are working that for those same veterans from what, age 19 to
Yes, ma'am.
World War II
Yes.
veterans.
Yes.
And so they're all at a different level.
Yes, ma'am.
Right. So
with different needs.
With different needs. And then when we get our senior citizens, sometimes communication
Right.
is an issue.
Communication,
And then their
transportation.
spouses, might not understand. And so
Right.
they need a little more hand holding
Yes.
than some of our younger
Yes,
people.
ma'am, and we're glad to do that.
So Denise actually works with some of our more vulnerable veterans, those that are just newly diagnosed with cancer.
Really?
And,
Yes, ma'am.
and therefore, that conversation that you have to have. She's just you're telling me in the car about that one veteran wasn't sure whether or not they wanted to do
Right,
therapy.
to do therapy, and we just give them the option because with like a new diagnosis of cancer, that's a big pill to swallow. So we just allow them to digest it and decide if they want services, if they don't want services, and we're there for them. And then if they choose services, then we coordinate that care. And we follow them through the course of the treatment. And then we also, if they need extra services from another specialist, then we also coordinate that. So we try to provide holistic care from the point of diagnosis, even through survivorship, just basically anything the veterans need and their families. And we say veterans, but a cancer diagnosis affects the family.
Absolutely.
So we're also there for the families.
Really? I mean, and
Yes,
so
ma'am.
you're doing pretty much what the hospice people do. I mean, you're trying to make sure that the family is very clear. You're providing them the services or the options.
Yes, ma'am.
And then they make a decision. And once they make that decision,
Right.
you walk them through it.
Yes.
And you said too, survivorship. That means through the journey.
Yes, ma'am, through the journey.
Really?
Yes, and we work with the social workers. So we do have a social worker that just specializes in oncology as well. So our departments are interrelated, and we just work together to provide the best care.
This is an awesome team, Dr. Boyle.
Where she sold herself a little short is the heart. So she was talking to this veteran the other day, and
Yes.
he didn't think he wanted to go through any treatment for his cancer.
Really?
And she said to the wife, you just got this diagnosis. Why don't you think about it for a while? I'll call you next Wednesday, and we can talk about it again. And then when she called him next Wednesday, he went ahead and said, yes, I want to have
Yes.
the treatment.
Yes.
So it's not like she was a robot that said, I'm going to close this
Right.
consult
No,
out.
but when
Right.
people really work and it's their passion, the things that they just do because it's second nature, they don't always brag because they're doing it from their heart. No, really, it makes a difference. And so I just think that you all are just doing fantastic work for our veterans and their families. And before we run out of time, I want to make sure they get your information again.
Okay.
People get the websites and where they can go and find all this great
Okay,
information.
for the choice for HealthNet, the number to HealthNet is 866-606-8198. And then also for claims, if the veteran has a choice bill or a bill from the provider that we send them to, they can also call 877-881-7618.
Okay.
And that is to discuss the claim.
Okay, so
Like
where's the
any-
universal website? If they want to know, they just go to va.gov and then they can maneuver through?
Yes, ma'am. There's an actual choice. They can type in, just Google www.choiceprogram or the va.gov and then type in choice.
All right. Well, Dr. Boyle, you're still doing it great. I'm so excited. I thank you for coming again today. We will continue to have you back.
Yes,
If there's
thank you.
something that you're doing and our people need to know about it, you're always welcome and straightforward.
I greatly appreciate your support, and this is a very growing area for us, so we're pleased to be here.
Well, thank you so much.
Thank
All
you.
right, thank you. This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.